All right, we're here today with Beth, and Beth is about to start her treatment with Dr. Davis. So Beth, tell me about your knees. How long have you had the knee problem?
I have had going on 15 years.
Ooh, 15? And what have you had done?
I've had 2 meniscus tear removals, so the arthroscopic and my right knee, both of those surgeries in my right knee.
Wow. And it didn't correct the problem, or?
It corrected it, but they told me I tore my ACL when I was in high school, and the scar tissue will continue to cause tears on my meniscus my entire life.
Oh, wow. Wow. Okay, so we had discussed earlier what your discomfort level was. What is your discomfort level in that knee?
Today it's probably about a 3 to a 4.
Okay.
And I also have my heel on the same leg.
Right.
With the plantar fasciitis. That is definitely higher than that.
Right. So your heel would hurt more than what your knee does.
Yeah.
Okay. All right. I'm going to have you do a couple different exercises for me. If you could just stand up for me, Beth. Go from sitting to standing. Any discomfort?
No.
Any pain there or anything?
No, my lower back a little bit today, but...
Okay. All right. So now I'm going to have you do a squat. So arms out in front, feet shoulder length apart. How low could you go? That's low. Okay. Any discomfort there?
Back up.
Back up is when you're feeling the pain.
Discomfort on this side.
Okay. But going down was okay?
Going down was okay.
Okay. All right. So now, Beth, I'm going to have you go up and down the stairs for me. Hold on to that railing, and I want you to concentrate on the muscles in the knee. All right. And we're going to go back up. Okay, so was it more difficult going up or down the stairs?
Down.
Down the stairs?
And it hurt on the other side of the knee.
So on the inside of the same knee?
Yep.
Okay, so when you were squatting, it was on the outside, and going up the stairs
Yes.
was on the inside. That's perfect. That's exactly what we're looking for, to know what muscle groups that you're using.
And it was down the stairs.
Down the stairs on the inside. Okay,
When
all
I
right.
was squatting, it was when I came back up on the outside.
Okay, that makes a lot of sense. All right, let's get you started. We're back with Beth, and Beth's finished her treatment with Dr. Davis. She did fantastic. All right, Beth, stand up for me. All right, I'm going to have you sit back down again. Any discomfort doing that, from sitting to standing or standing to sitting?
No.
Okay, I'll have you stand back up again. Let's try that squat. Arms out in front, and we'll have you squat down. And how was that?
That was fine.
Okay.
Left leg is popping down.
All the pressure's off of it. All right, I'm going to have you go up and down the stairs for me. And I had Beth go up and down slowly so that she can feel each muscle as it's moving in her knee as she's taking each step. So how was the stairs?
They were fine.
Okay, because I know down the stairs was more difficult for you. So do you notice any discomfort going down the stairs now?
Nope.
Everything is gone. So you're down to a 0?
Yeah.
Wonderful. We haven't even done therapies yet. So would you consider this a positive result?
Yeah.
Yes. All right. Let's get you started on therapy.